Good morning everyone, I'm Matteo Di Gioia from the Gioia Martinetti Orthodontic Studio. What happens when you transform a smile from this situation to this one? Well, it definitely changes the patient's life. These are some solutions that can be adopted for patients who have agenesis of an incisor, meaning a patient who is missing a tooth. Lateral incisor agenesis, a congenital condition, occurs in the general population in approximately 1 to 3 out of every 100 individuals, so it is actually quite common. You probably know at least 100 people in your social circle, so statistically speaking, about 1 to 3 of them may exhibit this particular dental characteristic. This particular incisor, located prominently in the very front of the mouth, is conspicuously missing either on the right side or the left side. So this specific phenomenon is indeed one of the more common and distinctive peculiarities that we frequently observe and encounter in the oral cavities of our numerous patients. What happens when a front tooth is missing? Well, you end up with spaces between the teeth, meaning there are fairly significant diastemas. And these have a decisive impact on the patient's smile. Because usually these are patients who don't particularly enjoy smiling or showing their teeth, since every time they smile, even after many years, they can still feel a bit uncomfortable. And so, at a certain point, they decide to resolve this situation. What we do is a case study, meaning we collect photos of the face, photos of the teeth, a lateral cephalometric X-ray to see the inclination, and also a panoramic X-ray, an orthopantomography, where it is shown, as you can see here in this yellow circle, the absence of the central incisor, the upper right lateral incisor. So, what are we going to do in this space? Well, these are cases that are called multidisciplinary. It's not enough to have just the orthodontist. To achieve the best results, it's necessary to have a team to collaborate with, such as at Gioia Martinetti's practice, where there are specialists in surgery. There are doctors who deal only with gums, there are doctors who take care of children. We need not only the skills of the orthodontist, that is the orthodontic specialist, but also those of colleagues who help us get through these situations so that the patient can smile in the end. In fact, there are several steps to improve this smile. Initially, we work on improving the position of the teeth in the mouth, since these spaces were too large and we would have had to create extremely big teeth. And so, they would not have been very harmonious in order to close these spaces between one tooth and another. But first, we move the teeth in this patient who already had a good bite and bring them closer together. So that later, an orthodontist colleague, once the teeth have been moved and brought closer together, will step in. Then there is a doctor who specializes in restorative dentistry who will enlarge them, who will rebuild them to make them bigger, since we're at it. In this case, we opted for an adhesive bridge. There is an artificial tooth bonded to the adjacent tooth. You can clearly see this in the photo of the teeth viewed from below. There is a suspended tooth here that starts to cover the gap. So, after the teeth have been enlarged by the doctor who handles fillings and aesthetic restorative work, you go back to the orthodontist. What does the orthodontist do? That is, in this case, I went back to move the teeth again in order to further improve both the bite, meaning the way the teeth fit together, making it ideal, almost textbook perfect, and then I worked to optimize and bring the teeth closer together to close the remaining gaps that could only be addressed with restorative work, that is, only with reconstructions. It wasn't possible to close them because the spaces were extremely large. This is the result after closing the gaps, partly thanks to orthodontics, where we brought the teeth closer together, and partly thanks to the reconstructions. At this point, it was time to add a tooth, thank you. One that isn't bonded to the adjacent tooth, even though that's already a valid solution. But to add a real, truly permanent tooth, meaning a tooth that is completely immovable, that absolutely cannot come off, because this particular one is currently just glued. And so, we meticulously measure the precise bone where the natural tooth is missing. We then carefully insert a dental implant in that specific area, and subsequently, we have to patiently wait for the implant to fully osseointegrate with the surrounding bone. So, during those 4 months, obviously we won't leave the patient without a tooth, but we'll reattach it. His previous little tooth, the fake one, attached to the neighboring tooth. So, on the day the patient gets their implant, you can see there are stitches, but they always leave the office with their smile because that's what they want, to smile, feel at ease, and live their life peacefully. We wait for the implant to integrate with the bone, and then we place the final crown on top. This is the beginning. You can see the significant gaps and the small teeth. These are the teeth rebuilt with composite. And this is the final result with a crown on the implant. Down here there is an implant and this is a crown. In this way, the patient can be sure that this tooth won't fall out because it's screwed onto a titanium root, which is the implant. This is the beginning. You can see that the alignment of the teeth could have been optimized and the spaces needed to be managed. And this is after the reconstructions with the teeth perfectly aligned in the back and the small tooth rebuilt. And this is with our implant. On the other side, the teeth fit together well, but not perfectly. And afterwards, in short, an ideal alignment, as you can see, a first-class molar relationship. And in the end, it's perfect even at the level of the premolars, which fit exactly between the contact points of the teeth in the lower arch. Initial situation in the upper arch, where the tooth was missing on the upper right. The teeth are brought closer together and enlarged with aesthetic reconstructions, and finally the crown is screwed onto the implant. Obviously it's a collaborative effort where the orthodontist brings the teeth closer together and creates the space to place the implant. And then the restorative dentist, who handles the conservative work, enlarges the teeth, starts to give them shape, and finally the surgeon will place the implant and fit the final crown. And you can see the smile. This is the best part. The initial situation and after the reconstructions, do you see what an incredible difference it makes? We brought the teeth closer together and also made them larger. It's not possible to just make the teeth bigger without bringing them closer together. Otherwise, they'd end up with frying pans instead of teeth. And then, with our implant in place, what we can say is that agenesis of the incisor is a situation. There is a lack of the lateral incisor which affects a certain group, 3 out of 100 people, so it's quite common. And in these cases, we need to collaborate with trusted people with whom we can achieve the best results. We thank Dr. Costavagna, a specialist in oral surgery at our Gioia Martinetti clinic, who assisted us with the placement and rehabilitation and then with the crown for this patient's smile. Doing these treatments isn't impossible. It just takes a bit of care, a little patience, and some time. In the end, we achieve truly great results. Thank you very much, and please give us a like. If you enjoyed the video, leave a comment if you have a question, and see you next time.